approach to the patients. Majority of the patients do suffer from viral fevers, and these viral infections, it is not always necessary and not possible to investigate and ascertain. So if some fevers, subsides within 3 to 5 days, 7 days, and at most 10 days, then you can consider it on symptomatic treatment or syndromic treatment as viral fever. But any fever which persists beyond 10 days in spite of empirical treatment, then you have to investigate it properly. And in those category, when the fever persists for more than 10 days, other causes that you can find out from the history, of course, in my common experience and practice, are enteric fever, malaria is less now, and it depends, it may change from place to place. But the part of North India I am practicing in, malaria is less common and enteric fever is more common. And then there are other causes, like commonest is urinary tract infection. So for practical purpose, the seasonal viral fever, which are undifferentiated in nature, majority will be, I would say 70%. And many of these patients will have sore throat, or throat, lungs, respiratory tract association. So you would know that it is upper respiratory tract infection with fever, and mostly these would subside. Uh, there is another group of patients, like dengue. So in those patients, again, there may not be, respiratory tract infection, but these fevers also subside. Normally in dengue, fever does not come back after 5 to 6 days. So if fever is coming of high grade after 5 to 6 days, it is not dengue. And that is the reason why practitioners and experts were surprised from COVID, because in COVID, we saw that the fever persists beyond 7 days, even longer duration. Even after post-COVID, people are suffering from mild range of fever. So COVID viral fever is different from the other viral fevers, because it is very contrasting in its course of illness. So normally in COVID, we have discussed in our earlier classes also that for 7 days it would be like normal viral fever, but if the fever persists beyond 7 days with respiratory symptoms, then you have to be very, very careful. But because it is the second week when the saturation dips, or when patient develop complications in COVID. So COVID virus viral fever is very, very different from the common cold or influenza virus, common illnesses that we see we categorize under the general seasonal viral. So this is different from, uh, differential from COVID and the other viral fevers. Otherwise, mostly we see in our practice, as I said, enteric fever, urinary tract infection, malaria, and at times other inflammatory diseases also, which we will be discussing later. So, as you look at this slide, uh, I've already defined the pyrexia of unknown origin. So, mm, in this, fevers of longer duration, there's four types, uh, which is, which we need to, consider from the practice perspective, and also it is mentioned in the literature. The four types, number one is of is called classical, which is, where there is no reason, there is no immunocompromise. The second type, classical, which is caused due to infections and malignancy. And the second type is nosocomial, which is, treatment acquired or hospital acquired. And then third type is of immunocompromise, where we have elderly, diabetics, and fourth type is of HIV. So these are the four categories of uh, pyrexia of unknown origin, and we have to work according to them. These broad classifications. So degree of fever is little predictive value in assessing the severity of an underlying illness. So fever may be mild, moderate, or severe grade, and many times, even there is hypothermia. Temperature decreases in cases of sepsis when there is extensive, endothelial involvement and vasodilation. Patient may encounter, especially in the compromised people, hypothermia instead of hyperthermia, fever. So, infections may be present irrespective of the severity or degree of fever. So, this is very, very important to keep in mind when we are dealing with patients of fever.